Cardiac arrest, also called a cardiopulmonary arrest or circulatory arrest, indicates a sudden stop in effective and normal blood circulation due to failure of the heart to pump blood. The victim becomes unresponsive with no normal breathing and no signs of circulation. Cardiac arrest, sometimes called sudden cardiac arrest, means that the heart suddenly stops beating. This cuts off blood flow to the brain and other organs. Cardiac arrest is extremely serious health issues. Each year, more than 500,000 people experience cardiac arrest in the United States. Cardiac arrest is usually due to underlying structural cardiac disease.
How does the cardiac arrest happens? First, the heart receives electrical signals that control how often it pumps and in what rhythm. Each heartbeat pushes blood through a complex network of vessels to organs and cells throughout the body. Disruptions to these electrical signals cause irregular beats, and this is known as the arrhythmia. There are many types of arrhythmias, and some may cause no symptoms, while the others can cause cardiac arrest. Cardiac arrest causes the heart to suddenly stop beating, which prevents blood from moving around the body.
Signs and symptoms of cardiac arrest. First, chest pain or discomfort, heart palpitation, rapid or irregular heartbeats, unexplained wheezing, shortness of breath, fainting or near fainting, lightheadedness or dizziness. Signs of sudden cardiac arrest are immediate and drastic and include sudden collapse, no pulse, no breathing, loss of consciousness. Sometimes other signs and symptoms occur before sudden cardiac arrest. These include chest discomfort, shortness of breath, weakness, fast breathing, fluttering or pounding heart. But sudden cardiac arrest often occurs with no warning.
What to do in case of cardiac arrest? If someone shows signs of cardiac arrest, contact the nearest hospital and ask for emergency medical services. If possible, ask a bystander to do this. Check if the unconscious person is breathing. If they are not, find an automated external defibrillator or AED if there is one nearby. If none is available, administer CPR by hand. Place both hands on the center of the person's chest and push down firmly 100 to 120 times per minute. Continue administering CPR until the emergency responders arrive. Before starting CPR, ensure safety first. Then the victim, for example, if the victim is lying on a road, take steps to alert oncoming traffic. Gently tap the victim and shout, "Are you alright?" If the victim can respond and there is no further danger from their location, leave the victim in the position they are in. If there is no response, shout for help. Send for help if there is more than one rescuer present. Ask that person to dial for an ambulance and return to confirm that the ambulance is on the way. Tell the ambulance dispatcher the location and telephone number closest to the scene and be prepared to provide other information before hanging up. If alone, the rescuer should assess the victim for unresponsiveness and absence of signs of life before going for help. The victim must be on his or her back on a firm surface.
How to CPR the patient? First is to position the casualty lying on their back and ensure that they are on a firm surface, and then kneel to the one side of the casualty. Locate the notch where the ribs meet the breastbone. Then place the middle finger of one hand in the notch and in the index finger to the next middle finger. Place the heel on the other hand next to the two fingers, and then place the other hand on top so the heels of the both hands are over on the same point on the breastbone. Next is to interlock the fingers to keep them off the chest, your elbows straight and lock, and your shoulders over the casualty's chest. You can press straight down using the weight of your body to compress the breastbone 4 to 5 centimeters, and then use a smooth interrupted rhythm allowing equal time for compression and relaxation. give 30 compressions at a rate of 80 to 100 compressions a minute, and then give 2 slow, full breaths, and then reposition the hands and administer a further 30 compressions, 2 breaths, and then continue the ratio of 30 compressions, 2 breaths, and then after that the 4 cycles of chest compressions breath, administer 2 further breaths, and then check the pulse.
How to reduce risk of cardiac arrest? First, eat a healthy diet. For the sake of the heart, avoid food that are oily, high in cholesterol, sugary, and high in carbohydrates. This kind of food increases bad cholesterol level, which clog the arteries and prevent proper blood flow. Next is stay active and have an exercise. Take 15 to 20 minutes a day to exercise. A brisk walk or bike ride are great ways to enjoy the fresh air while keeping your heart healthy. Next is reduce stress level. Emotional stress is a major contributing factor for cardiac arrest. Therefore, avoiding stressful situations and focusing on relaxing can help reduce the likelihood that people will suffer a cardiac arrest. Take it a step further and find a way to release stress through the likelihood that people will suffer a cardiac arrest. Furthermore, practicing deep breathing techniques. Last, stop using tobacco and drinking. Smoking cigarettes, chewing tobacco, and drinking alcoholic beverage can increase the size of the heart muscle. In addition, these habits tend to cause high blood pressure. An enlarged heart in conjunction with high blood pressure increases the risk of an individual having a cardiac arrest.
Are you ready to turn this place into a Holy Ghost dance party?